Good morning, and thank you all for being here today. My name is Courtney Lee Horning. I am the Director of Smokefree Communities here in Evansville, and we serve all of Vanderburgh County. We also do outreach to Posey and Warwick County. We work to educate youth on the dangers of smoking and other tobacco products. We work with healthcare providers to, we work with healthcare providers to encourage them to work with their patients to ask, advise, and refer, asking their patients if they smoke, advising them to quit, and referring them to resources such as the Indiana Tobacco Quit Line and other local resources. We encourage our healthcare providers to ask and advise and refer with every patient every time because it is that critical, and you never know when a patient may be ready to quit. We work with employers to include tobacco cessation coverage into their health insurance plans, as well as encourage and assist with developing comprehensive smoke-free ground policies at all work sites. We do all this to reduce the burden of tobacco in our county, but more importantly, to save lives. So why does reducing the burden of tobacco in our community and our state matter? Let me just give you a snapshot of what the burden of tobacco looks like in Indiana, and even more specific to our county, in Vanderburgh County. To this day, tobacco use remains a costly challenge of health, quality of life, and economic development in our state and our local community. This challenge is critical in Indiana, and we've said this before, where our current high smoking rate of 21% ranks us 41st in the nation, a percentage of smokers. In Vanderburgh County, our smoking rate is the same as the state. We are currently at 21% here in Vanderburgh County, which is roughly a little over 29,000 residents in Vanderburgh County that smoke. We can do better with that number, and we continue to see those numbers decline, but not at the rate that we'd like to see. Smoking is a major factor of death and disease in our state and county. We have a high rate of lung cancer deaths, cardiovascular disease deaths, as well as infant mortality. In Vanderburgh County alone, we see 9,549 smoking-related illnesses each year, with about 318 deaths related to smoking, and another 37 deaths due to secondhand smoke. The economic burden of smoking and secondhand smoke is huge, both locally and at the state level. Tobacco costs Indiana $5.4 billion annually in healthcare costs and lost productivity, with another $2.2 billion in excess medical spending and loss of life to those affected by secondhand smoke. Vanderburgh County feels the economic effects of tobacco too. The economic burden of tobacco in our county is $60 million per year. That's $60 million in Vanderburgh County. Employers in Indiana spend about $22 extra a day in extra business costs, totaling about $5,800 a year on their employees who smoke. This is due to the loss of productivity as well as health. As you can see, tobacco use doesn't just affect the smoker, it affects the impact of the employees, the employer, their families, and the whole community as a whole. Smoking has been one of the contributing factors to our high infant mortality rate in Vanderburgh County. Our county has made great strides in working on tackling that infant mortality rate, and a lot of those organizations and the professionals are in this room today that have really worked on reducing that number. And I will not point out and name each one of them because I will forget somebody's name, but while they're in here, I think we need to give them a round of applause for really tackling that issue. And I thank you guys. There's still work to be done, but it is moving in the right direction. And we can do the same when we are looking at other health outcomes affected by smoking. Like I said earlier, we are currently working with employers and healthcare providers to connect their employees and patients with access to cessation services. To make a positive change to our health outcomes, it takes work sites, including cessation resources and their insurance plans, to help employees quit, and having smoke-free grounds policies to help protect workers from secondhand smoke. It takes health professionals talking to their patients and guiding them through a quit plan and connecting them with resources to help them quit. It takes a community to push for policies that include protections from the dangers of secondhand smoke for all, regardless of where they live, work, and play. To give you an example of how comprehensive smoke-free policies work, let's look at the city of Indianapolis. They enacted a comprehensive smoke-free policy for the city in 2012, and within 5 years of that ordinance, they saw a 25% decline in heart attack emissions in their community. Comprehensive smoke-free policies work. And to kind of echo some words of Dr. Halverson, in addition to local policies, it takes changes at the state level. We need to advocate to raise the legal age of purchase of tobacco from 18 to 21. Increasing the age of purchase would be a huge deterrent for new youth smokers, both here locally in Vanderburgh County and across the state. And that has never been more important than now with the rise in popularity of the e-cigarettes that look like flash drives with our youth. We're seeing a higher incident of that now, and increasing the tobacco age could be a huge way to tackle that issue with our youth. In addition, we need to increase tobacco tax. This is the single most proven and effective method for decreasing our smoking rate across the state and locally. It is estimated that these two measures would help 50,000 Hoosier adults quit smoking, and it would help 40,000 kids would never start smoking. In addition, rates of maternal smoking would decline, and we could see 10,000 fewer impacted births over the next 5 years. Tobacco remains the deadliest addiction in Indiana, claiming the lives of more than 11,000 Hoosiers each year. 11,000. That is way too many lives lost to tobacco. We must get our elected officials engaged in the fight against tobacco if we're going to be successful in lowering the smoking rates and increasing health outcomes both here locally in Vanderburgh County as well as across the state. Both at the state and local level, we need to make changes in laws and policies to save lives. The good news is that we know what changes we need. We don't have to start from zero, we already know. Raising the cigarette tax, delaying youth access to tobacco by increasing the legal age of purchase, and working with communities and employers to include comprehensive smoke-free ordinances to protect everyone from the dangers of secondhand smoke. Not only do we know what changes we need, more importantly, we know that these changes will work. However, we need support. We need voices and we need advocates urging our elected officials to make these healthier changes. We can't do it alone. We need everyone working on this issue. The good news is everyone in here is working on that same issue, and we appreciate that. We can do better, we have to do better, and we will do better. Thank you.